Call this meeting of the Wayne County Commissioners to order. This is a special meeting that we called last week. And the purpose at that time was for us to discuss how we were going to work with each of our individual departments as to how far down we would take those departments, what we would do in the courthouse, and then we would be discussing how we were going to pay our individual employees. Well, since we scheduled this meeting, a lot has transpired and taken places, and then today at 12 o'clock the governor came out with a new order. So there's been a lot of changes that has transpired. Just to kind of brief the public and bring them up to date, on Friday we did have a news conference here where at that time we had asked all of our businesses in the community to reduce their staff by 30%. As soon as possible on there. And we had several other things in there. Of course, the main thing, again, that we had talked about was to encourage our folks to stay home. Based on the checks that I did over the weekend, I can certainly say I think the folks in Wayne County are getting the message that you need to stay home, because you only saw cars around the grocery stores or drugstore or something like that. So I'm very pleased to say I think the folks in Wayne County are taking this serious as to what we need to do, and as they'll tell you over and over again, wash your hands, wash your hands, wash your hands. Do not leave home if you don't have to. Earlier today, with the governor talking about the staying home, there was some confusion as we listened to the broadcast as exactly what he was saying 100% in there. And so we've been working through that yet this afternoon to find out exactly what he meant by that. But I can tell you what Wayne County is going to do in our brief discussions we've had is we've talked with our departments, and our departments have all been prepared in the last couple of weeks that if we sent even more than 30% home, they could function and they could operate with less people. And so one of the things that we will be doing today is to send even more of our county folks home. And we're leaving that up to each and every one of our department heads to determine what they need in their office. Can you get by with just one person there, or can you get by with two to function? Our IT department has been working to provide all these individual departments with laptops so that we can continue to maintain county government, keeping it function as best as possible from home. In some cases, it's just not physically possible to do some things from home. So in those cases, you might find one or two more. But it would be my guess from by tomorrow that you will see us shrink down to where we'll have maybe only one or two people left in each of the individual offices. The trustees department is 100% out and functioning out of a couple of other places, which is very helpful to us. The probation department 2 weeks ago started changing all of their appointments that they had with people that were on probation. They were doing those on the phone. So that has been very helpful in bringing considerably less people actually into the courthouse here. Our HR department and our legal department has been working on all the legal ramifications that we have to come up with so to make sure that we comply with each and every one of the laws that we have. We know that one of the key things that our employees are asking us is about pay, whether or not they have to take comp time, vacation time, or sick leave. What we will be doing as we are asking these folks to go home, we will be paying them for.
We haven't made that decision yet.
Well, we'll be talking about that in just a minute here. As to those folks that we would be paying them because we are sending them home. If you read our personnel manual on there, it so says in our personnel manual that we have in place on there that if we ask our folks to go home, that we will pay them when we ask them to do that. So that'll be one of the things we'll confirm here, yes or not, today as we have our discussion on that. We've been trying to go through the government's edict that the governor had today. There's a lot of things in that. And so what I'm going to kind of do first off here is to kind of open this up for discussion among the commissioners, because we have been practicing staying at home also, so we haven't been together, as Mary Ann said, to really talk. So we're kind of getting together for the first time here. We've been compiling information and stuff as to what we maybe can and can't do. So what, this might surprise Ron, but I'm going to call on the legal side first. That Ron, if you have anything that we need to look at or to consider as we begin discussion here, I would certainly appreciate that very much.
Other than 4 executive orders that were issued this afternoon that I have not had a chance to review.
Yeah, we haven't, I mean, since noon, there's 4 that has come out, and we're not sure what's in those 4 executive orders either. But let's go for discussion purposes of what we're looking at
Mr. President,
of sending more folks home.
I move
Denny?
that we absolutely send every employee that can possibly work from home. In some offices, I hope that'll be 100% reduction. In offices where it can't be 100, I hope it's 90 or 95%. Your idea of 1 person in the office would be perfect for me. But as far as letting each department head and elected official do what's best for their offices, as long as they know what our goal is, I'm perfectly confident in the people we have. That's my motion.
I think we
Okay.
need to discuss that to be absolutely certain that the governor's executive order overrides the ghost employment law. You know, ghost employment.
It does not.
It
I
does
mean, I think
not.
it will, but there will need to be resolutions passed. That they're ready to, I mean, there's a template that's out there that we've used for other governmental entities, and we can readily do that. The point being, until just this moment, I'm not aware that even the decision had been made on that by this body, at least, or if it has it as yet.
Well, it
May
has-
we take that action, Mr. Cross, before we actually put a resolution in place exempting that action from the ghost employment laws?
Don't worry about the ghost employment laws per se. That'll come about because the State Board of Accounts has said that if your actions are evidenced by either a resolution or ordinance, if you have the capability of which you do, or your actions are discreetly identified in the minutes of your official meeting, then they're not going to take audit exception. That being said, I think whether we do it after the fact and make it retroactive to a date certain that you would tell me, which I assume would be midnight Wednesday, when the effective
The governor's order.
executive order
Yes.
22008 goes into
Yes.
effect, then
And his order,
that will be the way we would handle it.
his order
I needed to
calls,
hear that. I take ghost employment law very seriously.
And that was a phrase that was bandied around early in the discussion process, even at the time schools were initially ordered to be closed.
You've been through this, we have not. Thank
So
you.
your points are well taken.
I do have a motion on the floor.
I want to clarify that your motion does include full compensation for part-time as well as full-time employees, does it?
no, it does for full-time. We need to work with council to decide what we're going to do with part-time. I mean, as far as we can make a recommendation, but this motion includes full-time employees.
Let's discuss part-time.
I don't-
Because part-time employees very much need to be paid, feed their families as much as full-time employees. Why did you not wish to include part-time employees?
Because I've been told by council that they support what we're doing, but they weren't unanimous on part-time.
When did council meet to make that
They
decision?
didn't meet, Mary Ann, they didn't meet. This is an emergency. We don't meet.
How do we know council's point of view?
Well, I know council's point of view.
I do not.
Well, you do now. I just told you.
The, Denny has talked to President Plaster. I've talked to President Plaster and East Lawn because my main concern was trying to get our employees paid. His indication was that he would agree with paying all of our employees based on, right now, our personnel manual says that. If we send our employees home, we will pay them. And he was going to have conversation with all his members of council to inform them what we were looking at doing based on what our personnel manual is and what it says in there currently at this time. The part-time thing came up later for discussion. I haven't had a chance to even ask our HR if we have anything in our personnel policy at this juncture on a part-time person if we send them home.
Part-time? Does our handbook address part-time as it does full-time? Yeah. No.
It does, and that was
manual
our.
doesn't address paying full-time employees for.
Yes, it does. It says if we send them home, we will pay them their salary, and we are sending them home.
Is there a
In a
duration?
What
weather
we're talking.
Is there a
situation.
duration period stated in that policy? Because that surprised me a little bit.
I'm sorry.
Is there a duration for continuation of pay? I'd like, do you have a
I'm
policy?
gonna go get the handbook.
Get the policy. I'd like to see it, because I have to confess to a little bit of surprise that that was in there.
I think we ought to
Yeah.
look at that language.
Yeah.
You know, regarding part-time employees, a part-time employee working 29 hours a week would be losing a significant amount of income suddenly and abruptly. And I think we need to take that sudden and abrupt loss of income very seriously.
I do not disagree with you at all. We haven't had time to get to the part-time thing, and maybe we can, when she gets that, if we take time here today, with everything that we've had going on, to get to that one. My goal was to get full-time people underway so they knew today, then to work on the part-time, and then whatever we needed to do there, to do what we could do on the part-time
And we're not telling
people.
any department head or elected official that they can't continue to utilize their part-time people from home, if that's what they do normally. If that normally what their job is, if they can do it from home, of course, do it from home. It won't change anything.
That was all I was
All right.
suggesting, is that if a department head or elected official can utilize full-time or part-time people, I do not want to exclude
Okay, I can
the
add, I'll
department
amend my
head's
motion.
discretion of sending that part-time employee home with a briefcase full of important work that very well can be accomplished at home. That was my only question.
Okay,
And I think it needs to be clarified in that motion, and I was only questioning whether that was the intent of your motion.
it is to protect part-time people as well as full-time people, but that decision is going to be left to the department head or elected official.
Okay, before you vote,
Well,
I'm gonna need-
we're not going to vote, we're not going to vote yet until, we've asked HR to go and get that, so I'm going to wait until she comes back, so we can look at that.
Please realize, too, you're not operating in a vacuum here. The federal government has interceded in potentially in some of these issues.
That's correct.
With President Trump having signed the Families First Coronavirus Response Act, I think the evening of March 18th, that will become effective April 2nd. And it could provide for compensation and continuation of compensation for both full and part-time employees under two provisions. One, the Emergency Family Medical Leave Expansion Act, and I assume we're still fewer than 500 in our number of employees.
We are.
So we're governed by that. And if an employee has a child whose school has been closed and/or whose child care facility has been closed, then that employee would have the right to if full-time, seek and be granted extended family medical leave for up to 12 weeks at roughly 2/3 of their regular pay, not to exceed $211 per day, and not to exceed, I think, there's a cap on the aggregate. So that's out there. We're governed by it, we're subject to
Right.
it. And then there's another federal act that was passed as part of that same overall legislation relating to what is now
Did you make copies?
deemed federal paid sick leave.
Ron has the next.
Which we can talk
Oh,
about
only one
later, those are
copy?
separate issues. I
No,
Okay.
only one.
didn't mean,
Right.
while we had a lull there, I thought. So I think there is a 3-day duration period on that I think most of us expect.
This is going to be longer than
The
that.
current,
Yeah.
My motion is at least for the duration of the governor's executive order.
Which could then be extended
Yes.
by the commissioners, that if it was longer than that. Ron, what do you think legally wise? How do we need to address that so that our auditor is covered? I know the State Board of Accounts says they
well, I
won't
think
take
you're going to
any
have to have
exceptions.
you're going to have to adopt a resolution to
Right.
do that, that'll
Okay.
spell it out in detail. But I think the intent, as I'm hearing you, at least as it relates to the issue of continued compensation, would be continued compensation for those employees sent home at their regular rate, with the encouragement that each department head, if feasible, provide work-at-home opportunities for those employees.
Okay.
We also could specify that that employee must remain on call for a specific number of hours per day, perhaps.
The typical resolution that I've prepared for a couple of other entities and that we've used in others will say that, A, they should be on call and leave their supervisor or elected official with their current contact number during their customary business hours.
Okay.
B, during their non-overtime customary business hours. B, they shall not accept outside employment during their usual non-overtime business hours and while they're receiving their stay-at-home pay, is what we typically refer to.
And the reason
And
for
there'll be
that
other
is
issues.
the ghost employment type thing. that
Well, the
you
reason
talked
that's
about.
the
Yeah.
flip side of ghost employment.
Right.
It's
It
the
makes
disdain the
sense.
state has for double dipping, if you will, or being paid contemporaneously for,
Right.
out of public funds for two different functions that you physically can't do at the same time.
Well, the governor's order says that all businesses and employers, whether or not they are deemed to be essential under this executive order, are ordered to take the following actions. Allow as many employees as possible to work from home by implementing policies in areas such as teleworking and video conferencing. And that's what we're trying to accomplish today.
Okay, now, we do have resources that IT have been working on for a number of weeks,
That's correct. I mentioned that earlier, yes.
right?
And we're ready to go.
Have the department heads made known to us those tools that each of them need in
No.
order to accomplish this?
I've encouraged them to deal directly with IT and not go through us, to deal directly with IT, and they have.
Right.
They have.
Okay.
And IT's been working on that. Yes, Rich?
I've been working on that, I didn't even know we were having this yet.
Come on up here, Rich. Cool, come on up there.
Want me around?
No, come up there.
Go up there
There's no
so they
microphone.
can, that way you can be on camera better.
Oh, now I'm going to pass out. Okay, well, we were originally talking about this 30% of the workforce on the meeting that was Friday, that we have. Keep in mind, I have had 39 laptops total, and we have a lot more employees than that. We were trying to keep the using employee stuff to a minimum or not use their computers at all. And obviously, that's not possible with a number approaching, I think, 90% or 80% or whatever it is. So we have worked on a way to be able to use the employee's home computer to do this and still keep the security intact with the county. So that's what we're working on right now. What we're attempting to do is take the essentials. I know you said something about all employees, but I'm going to bang that about 10 more times before I'm done, or so I need to step away from it.
Step
Because I
away
talk
from
with
the
my
mic.
hands. When I get excited, I talk even more with my hands. But I need to be able to distinguish what people normally do that need access to a computer and to the county's network from those that are taking care of somebody that walks in the door that is now not walking in the door, so we can prioritize those resources that I do have. There's a lot of people I'm finding out, and I really wasn't aware of it, that don't have computers at home. It just seems like an impossibility to me, but I'm finding they don't. So we are going to need to provide resources in some fashion. So just to,
I know it's not, I don't know how quickly you can get these resources, but I think we should make every effort to do, now, I understand you have over 30 laptops that you are,
we had 30 this
39,
morning,
yeah.
so.
30 this morning.
And I've got to get people to, I know you have 9 employees, but we were initially talking about 1 or 2.
Yeah.
But now I need all 9 of them to
Yeah.
do it.
Yeah.
I'll run out of that in the first couple of
All right, I think you
offices.
need to talk to, the department head is going to have to negotiate with you on what is absolutely required. Because if you don't have the resources, they're going to have to live with that.
And you'll have to say, okay, each department gets 2 or whatever we have available to us, you
Well,
know.
we
Yes.
took care of the payroll and the accounts payable
The most
because
important
those are the
Right.
ones that were in the.
Now, we got that done last
I
week,
think when we
yeah.
did the H1N1, we had that plan already out for that. So
Mhm.
those have been taken care of. So we get
So-
paid and we
Well,
get
Rich, a
repaired.
department head that doesn't have enough remote laptops in order to do that, they're probably going to have to come in the office and do it in the office. If we don't have the resources for them to do it at home, they'll have to come in and do it here. So it's not the end of the world for you. Do the best you can.
And do we need, if we got other locations to put them in, that was kind of suggested in the meeting that we had when we were throwing together ideas about people that, if social distancing is what we're trying to accomplish, could we use other facilities we have, in particular Raper and Coleman, which
Well,
large spaces.
that-
my next
But-
proposal is going to be to give Raper and Coleman and Elder Behrman to Reed Hospital.
We've already got those kind
We're
of
gonna do-
committed
Okay.
at the moment,
Yeah.
if necessary to be used, so.
Why don't we make that decision later? All right, let's just do what we got to today.
All right,
It-
that's what I came over here to
All
talk
right.
about.
Okay, but you need to understand, it is up to us and to our elected officials that we have to be able to, we can make that determination based on the government's order here of what essential is and what we have to have in the office. So if one office has to have 3 people in the building here in that office to keep it up and running, we can do it. If they need 4, we can do it. If they don't, then we'll put the other folks home at that time. So that's something that we can do on there, Rich, that by this order, if we have to keep, say, A offices, there's no way you can do it from home. We could bring all those folks on to keep that office and running based on the government's declaration here. So keep that in mind, and we've tried to explain that to all the folks today quickly since the governor's conference at noon on there.
Right.
Do you have any county-owned smartphones?
In my department? No. We have, our employees own their smartphones, but they're connected through the county pays for the Verizon service, but the employees have own their own phones. I believe that's the case with everybody, but
You don't have any
The majority of them.
inventory of some old out-of-date ones or anything like that. Have you been connecting some employees' own smartphones with the county email that might help augment at least email on their smartphones that would reduce the need at least for additional laptops? That might at least get us
We have done
expanding.
some of those. We haven't had a lot of requests for that. I think majorly that once this press conference or this announcement was made and the numbers started flying about how many people were going to need our resources, it became necessary for us to look at ways to use what we do have. If we have a person at home that has a home computer, then we are providing a method to securely access their computer.
That's
at-
perfect.
At the,
That's what we need.
at the county. So-
Rich, that's all you
In-
can do.
In answer to
Yeah.
the phone part, we can do that. We do have the ability to do that. The employees still have access to their phone mail, no matter where
Rich,
no matter
stop
where
it.
they're, you knew that was no matter where they're at, they'll be able to access their phone number by dialing 973-9375, enter their extension number, put their password in, and get their voicemail messages.
man.
Most of the people that
That's perfect.
do that on a regular basis already know about it, but people who don't, they do have that ability.
And so their
guess I'll
voicemail
have
they
to
can
pay for this
access,
microphone
and their
now.
email they can access, but they have to take their phone to IT. Now, as far as getting office email
Wait,
on
wait a
their-
minute. Why do we have to take our phone to
Yeah,
IT? Go back to
I don't
that.
think they'll have to take the phone to
To
IT to get that. I mean, we can certainly help people
I mean,
that
to
don't
get
know.
email, to
Well,
get email.
no, they put it into their
People
phone
that
themselves.
don't know how to set up their phone to get their email, we can assist with that.
Oh, you can
But
assist
we're
with-
not saying like you can't get your county email from your phone, you gotta come and ask us
Mike,
permission.
Most of them are already on
That's-
their phone.
That's not the case. They have access to it. We're willing to help with the setup of that to facilitate them being able to get it, but they don't have to ask our permission to use
So
their
you
cell
don't
phone
have
for
any
that.
idea how many of the county employees do have access to their county email on their phones?
I don't know how many people already are using that access. They all have the ability to do it.
Okay, they all
Their
have
their
to
county email, there's a webmail that they could use their
Go through
computers
the
to go
webmail
through
and
it.
do it.
Mhm.
Thank you.
You're welcome.
We know you got a big job ahead of you, and we appreciate all you're doing. And I know it's taken a few hours on there, but you've got
Right.
one of the best staffs in East Central Indiana.
I'll second that one.
Okay, all right. Okay,
So we have a
back,
motion on the floor.
back to the long motion. Is there, Ron, something that you can give our recording person how we should state that motion for the payment of folks that?
Maybe.
Maybe,
That
okay.
assumes I understand it. I understand that the motion is to commencing midnight.
Yep,
Mhm.
tonight.
Tonight.
effect midnight tomorrow
Or
night.
effective tomorrow morning.
Yeah, with the governor's order. When is it effective?
Yeah, the governor's executive order goes into effect
Let's see.
at midnight on March.
Yeah, March 24th at 11:59
Yeah,
PM.
midnight tomorrow night. It's
Okay.
effective
Midnight on March 24th.
Yeah.
midnight, March 24th. Those employees who have been identified by their department heads as being I wouldn't say unneeded, but
that can work from
being
home.
capable of release from their normal work activities shall be fully compensated in accordance with their regular daily rate.
And how do you address part-time?
Part-time employees would be similarly
Would be the same.
compensated
You didn't say just full-time, you said employees.
Okay,
You need
all right.
to-
No, if you said employees. that's-
Employees, that would cover them because they're working their
Employees
29.
identified by department head as being capable of being released from normal work activities will be fully compensated at their daily rate.
And with the caveat with part-time, obviously, since they're part-time, there will have to be a proration of the number of hours that they're.
Would you rather say hourly rate rather than daily rate?
You said hourly rate, it would include those part-time people.
Yeah, hourly rate would be fine, but,
Because even salaried people now have an hourly rate, don't they, Kim?
Yeah.
well, they should if they're non-exempt. But the point being that the part-time are only going to be paid for their average number of hours per work week.
Okay, I'm gonna put that.
Yeah.
So, and part-time will be prorated at average amount of hours worked in
Their normal work week, yeah.
I talked to Betty about that this morning, and she said that's what she would prefer to do.
Joe, I think I got it.
Okay,
Okay.
she's got it.
She's got it. What do you
I will
think, Mary Ann?
second that.
Very
So
good.
that will be effective at midnight.
Night tomorrow.
Thursday night,
Yep.
and
No, Tuesday.
Tomorrow night.
I'm at Tuesday night, so that will affect the morning.
Wednesday
The
morning.
annex in the courthouse opens on Wednesday. Because this will not affect our 911 operation. It won't affect the sheriff.
That's correct.
It will affect the highway.
That's one I've got for discussion, okay?
Well, the way the motion reads, it certainly affects the highway.
Well, we ought to talk about it now then, because I want to include highway in this motion.
Okay, the question is, and we have, as I said, the authority to determine essential highway departments are, even when you read this a little bit, are connected with transportation, the ability to maintain the highway system, and in our case, the street and road system on there, that if we had a call out or something on one of our roads, that we could continue in that area if we wanted to, or Denny, we could cut back a certain percentage in that area and have them work it out. Because if we had a major snowstorm, we would want all those people in place to be able to run their snow routes and so on like that. So the question is, do we cut them down now and then have a call in for them, or what we might do in that particular question?
Well, Ron said the resolution would say, specify employees would remain on call, that they would be on call and provide the contact number for the regular business.
That's what the
hours.
resolution will
Yes.
say, yeah.
It doesn't
Right.
exclude highway.
Should not accept outside employment during the.
And I don't want to exclude highway. I want them included.
Okay. Yes, I'm not going to keep highway up and functioning. Don't anybody run into anything or knock stuff down.
No,
Well,
sure
until-
you
I know,
can.
we can have to call
We'll
them
have to
in,
call
but,
them in.
all right. Forget that, we've got a motion on the floor. All those in.
I second.
I know you did. All those in favor signify by saying aye.
Aye.
Aye. Passed unanimously.
Do
Okay.
we need the caveat about emergency exigencies? Does that go without saying?
Yeah, it goes, Mike would,
It has been
Mike
known to
would call
snow in
them in.
March and April.
yes, I know. Now I lost my thought, Mary Ann.
Is you going to go on to the Elder Beerman Coleman property?
Oh, yes. We have been in conversation with not only Chief Purcell of City of Richmond, first off, of our ability to cover first responders, and we made the Raper Center available to them, that if we had first responders that would get COVID-19 or was suspected of that, we need to isolate them, that we could utilize the Raper Center for that purpose on there. And they have cots and stuff available, so we did do that, but in further looking and watching what has happened on the West Coast and the East Coast, we have made available to Reed Hospital, if the need came, that we would make those 3 facilities available to them to put beds in also. So we just wanted to make everybody aware of that. That just happened
How long have you made that?
this for how long? We have not made it for a period of time. We made that offer to them. They were having a meeting today also. They were going to discuss that as to whether they felt there might be a need or not for that. If you'll recall from our press conference that we just had, there's a possibility that if Reed overflowed here, that they could go, for example, possibly into Connorsville if there was space available there. So at this point, we haven't got into a full discussion on that, so that would come down. I'm just bringing it up that we have made that offer. We'll have to have more discussion on that, that if it was needed, what we would do and for how long on there.
As you know, we've canceled all rentals that we've had through.
That's
April
correct.
16.
That's correct.
So I have a sense.
I'm
Would imagine would like as much
notice as possible.
We
I'm
don't know if
sure.
they're going to take us up on it.
Yeah, I'm sure they'll get back to us, and the unfortunate part, which we've said many, many times, and the question always comes up if you watch national news, the reporters ask it all the time, and I just shake my head, Mike, because they say, how long do you think this
When's
is
this
gonna
gonna
last? When do you think this is gonna end? And if you listen to the medical experts, they'll tell you, well, you know, we just don't know. It depends. We're watching this. We're trying to get some stats to figure it out. And constantly they'll tell you the whole purpose of what we're doing, all of this, is to flatten that curve out so we don't peak way up here and overflow the Reed hospitals of the world so that they can hand those folks that are really, really sick. And that's what we're working for. But at the same time, those of us in our positions, we need to look ahead and what could happen. We're fortunate here in the Midwest. We don't have the density that California or New York has. We're spread out. If you look at your neighbor, normally you're more than 6 foot from your neighbor. In some cases, probably in Mary Ann's, half a mile or more before you may have
I'm
a
a half
neighbor.
mile from my nearest
Okay,
neighbor.
so.
Half an hour from your garage.
So you know, we're trying to look ahead and see, okay, if that would happen to us, and I hope it certainly doesn't. And as we talk with the medical people and with the hospital, if we get participation from all of our community people here, do what you are, stay at home. And that's what the governor say. If you don't have to go out, stay at home, take care of yourself, wash your hands, and only go out if you need it. And don't buy 3 months of toilet paper. It seems everybody's buying toilet paper. And I was told this morning in Ohio with our HR director that somebody broke into a chiropractor's office. And what did they take? Towels and toilet paper. That's all they took. And so, folks, there's 2 months distribution within the food chain. If you listen to there's 2 months of food distribution in the food chains. The only thing that upsets that is when all of us go in, instead of buying our normal supply, if you go every week or every 2 weeks, you're buying 4, 5, 6 weeks supply, and you don't need to do that. The stores have it, they'll do it, but they can't handle that just overnight because it takes a while for them not only to order the stuff, but for it to get to the warehouse, for it to be pulled, for it to be put into the truck, for that trucker to get, say, to Kroger's or to Myers here in town, and for the stock boys to get it unloaded and get it on the shelves for you to take it all out in 2 hours or something like that. I know Needlers the other day closed for a couple hours just to restock their shelves. So we need your help and your assistance out there, and you'll hear us keep preaching that, and the experts are preaching that. We can level this here so that the Reed hospitals don't get overwhelmed with patients that really need their help, that are really, really sick on there. And reemphasize, since we're on the air again, is young people think that it doesn't affect them. And very frankly, it does up to around 49 or 50 years of age. And even if you're only 20 or 23, you don't want to go, like if you look at all those folks that are down in Florida for spring break, having a break time down there. They shouldn't be there. They should not be doing that, and they shouldn't be coming back to our area and going to see their grandparents or something like that to say and tell them, oh, I want to tell you about my trip to Florida. because they could be carrying that for 4 or 5 days, you know. So, hey, guys, it's affecting all of us. This is all of us here across the United States. We need you to stay home if you don't have to go someplace. But the essential services and the government reiterated it all here again, that if you have to go to the doctor, you got to go get medicine, you got to go get food, you need to go through the drive-through restaurant, you can do that. So do those things if you need to, and otherwise, stay at home, stay at home. So that'll cover
And I'd like
that.
to go back to the
Yeah.
offer to Reed to have patients who are quite ill, in especially the Raper Center. Reed may not be aware of all the livestock events that are held in Raper. I feel that that particular building would have to be sanitized at great expense before extremely ill patients should be put in that building. I'd really like to reconsider that offer before it is
Well-
considered. I think gymnasiums, I think we have a lot cleaner buildings that could be sanitized at lesser expense before Raper
let's
would
let
be
Reed make
considered
that
as a
decision.
very last
Well,
resort.
Denny's right, Marion. We made the offer to Reed. Those folks are very, very knowledgeable what they need to do.
They just may not be
Jim-
aware of all the livestock.
Then we'll
that-
tell them, we'll tell them.
Then we'd be happy to tell them, and even if they were going to utilize that before they came there, I'm sure they would look at all the sanitation conditions and what they would need to do to make that place a place that was safe for those folks to be. They may not put the most serious ill folks in there. It might be folks that need attention, but the most serious ones would be at Reed, where they would have all the necessary equipment for them. But Reed would certainly look at that, and you're right, gymnasiums are available. I'm
Much
sure the
preferable.
school would be more than willing, but we have made the offer. They thanked us and said they were going to be discussing that possibility of other things as they're looking down the road. So I think we're all right at the moment. Reed would not go there if they felt it was not the thing to do.
Mr. President?
Yes.
I move to close the courthouse for an undetermined days per week for the duration of the governor's order based on consultation with the judges and our probation department.
Marianne, you have any questions?
Were the
on what-
judges aware of the other activities that allow people to come and go?
Yes.
What about the clerk's office?
Clerks, there are employees. They're-
Well, but they're in the
Yeah, well,
courthouse.
They're going to implement our plan here.
Yeah.
Same thing we do.
Okay, so when we say we're closing the courthouse,
Well, we closed,
Well-
same as we closed this building.
okay.
It's closed to the public,
Okay.
and you can call in with all the phone numbers that have been published on there, that if you have something specific, you can phone the individual departments, not only in the annex building, the auditor, the treasurer, and the recorder, the assessor, any of those offices, probation office, you can call, and they will answer your questions. If for some reason specifically you have to come in, they would set an appointment up with you to come in. Or they might even make arrangements for you to see one of those people they have sent home that could answer your questions for you. The courthouse would be the same. We've met with the judges, and they're willing to work on that and to reduce. Matter of fact, they already have reduced their staff starting this morning by 30% already in that area. So they're working very well over there. So
So Jen, am I hearing you saying it's your expectation that each department head and elected official keep their office operational to the public?
Yes.
Whether
that's
it's
correct,
in
but the buildings,
Right.
Okay.
That's
the
correct.
the buildings are closed, those offices are up and functioning, doing, for example, the treasurer's sitting down here to tell you what they've done, and she had an interview today with WCTV talking about taxes, which are going to be coming due she'll be sending all those tax bills out prior to April the 15th, and so I encourage you to tune in to WCTV, where she'll give you all the updates, the information. You have the ability of going out to all of the drive-ins for First Bank Richmond and Wayne Bank. Are those the two? Okay. drive-ins. We'll also be putting a spatial drive-in, like a big post office box that you put your mail in, that will be located out here in our driveway and will be specifically labeled and everything. We're in working with Debbie Berry at the clerk's office, that folks will be able to make their child support payments in that box also.
Kathy Williams.
And all the treasurers will be able to pay your taxes once you get those tax bills, that you can drive through and put them into that box also. So we're looking at different things that we can do. I encourage you, Eric, do you know when she might be coming up on WCTV?
Hopefully by tomorrow evening.
Okay, by tomorrow evening, look on the guide, I suppose, would say that, look on the guide on your TV set, and it'll be on social media. So if you have any questions, you can see it there. If not, call the office, and they'll be more than happy to explain it to you. So that's just what one office is doing, and we're doing our best to make it as convenient and as safe for all of our taxpayers on there, that you can not have to come into the office to pay your tax bill, because I can assure you, and Kathy is, that a lot of folks, when they get that tax bill, I'm always amazed, they're down here the next day. And I assure you, I've seen that line wrap all the way around with folks, and we don't want them coming in. Well, they can't get in the building because we've got it locked, but we don't want you coming in. We want you to be safe. All of our concerns here is to keep government up and running, and to keep all of our employees safe so we can keep government up and running, and to encourage you how serious this is, because there are folks out there that aren't taking this serious. And you heard that today in the governor's presentation in his news conference. And those folks, very frankly, are going to lose their license and have a very heavy penalty to pay. So folks, heed what we're telling you on there.
I have a motion
Jenny, was
on
that
the-
a motion to
Yes, it
close the
was.
courthouse?
It was. We kind of got sidetracked
Oh, we
there, but
did.
that was a
Mary Ann,
motion.
did you second
I
that?
would like to second that, but I don't want to do it tomorrow. I think we need to give child support, voter registration, the people who accept, some people go there to pay their traffic tickets and things. I would
We've-
like to make that Wednesday.
Debbie already has a plan. Debbie has
Well,
a-
Debbie may, but there's other offices that are in the courthouse too. I'd like to make that effective Wednesday, the same day that, this would be effective.
Oh, okay.
We can do that, Mary Ann.
Give them tomorrow to notify their clientele.
Sure.
They've already,
Effective Wednesday, the
just for your
25th. If you'll
information.
accept that
Yep.
amendment, I will second it.
they've all been doing that, so, okay, it's
Well-
unanimous.
But they wouldn't have time to notify anybody.
Effective Wednesday.
Yeah, okay.
One
Got
point
that
of
one done?
clarification, because it wasn't, I don't know if it's clear or not, but if there are any court employees who are displaced or relieved of the obligation to come to work and not working from home, will the judges be issuing a continuation of pay order, or do they expect that the order you've issued for county employees to apply to their court employees?
Denny, did you happen to talk to
Yes, I
them
did.
specifically on that?
When we first talked to the judges about this, that was their question, is will they be paid? And we told them yes. So I think the judges have assumed that their employees will be treated exactly the same way as the employees that come under our jurisdiction will.
Now,
It's not in writing, but that's their understanding, and frankly, it's my understanding too.
Right.
what about public health? Do you feel they're in emergency mode, that they will be exempted from this?
Of course, they'll be exempt.
They are.
Yeah.
Very
And
good.
the-
Just like
Just like I
911.
said, it's.
EMA's
yeah.
facing the same thing. They
Right.
can't walk away.
911's going to be working all those folks, and they'll all be there doing their job.
Yeah.
And the clinic is separate enough, they will make their own decision, even though those are county employees?
That's correct.
And will they be informed of this tomorrow morning, or will a message go out yet tonight?
We can do it tonight, yeah.
Would you be agreeable to modifying your previously passed motion to add the parenthetical after we say all employees? Parent including court employees?
Yes.
Yeah, sure, that's
Including
fine.
yes.
Including court
I amend my
employees
motion.
that they be paid.
Yes,
Yeah.
yes. That was Denny's motion, I think.
Well, they added. to
I
it,
amended
to add-
it.
We amended to add the court
And
employees. Yeah.
I'm amenable to amending my second to allow that amendment, yes.
Okay.
So I take it it's passed unanimously by as amended?
As amended, yes.
Yes.
Mhm.
Of course, this may affect the sheriff's
Have we,
security team. Security won't really be as in high a demand, although people
Although
will
the
still
sheriff,
be
well,
coming
now, wait a
in.
minute, I talked to the
There
sheriff.
still will
The
be
sheriff is
people in
all
the
excited
buildings.
about this.
That gives
'cause
him
he
4
needs 'em at
extra
the jail.
people.
He
Yeah,
needs
so
them over at the
he's-
jail.
What is happening at the jail are,
There's a bunch of people incarcerated over there.
and
Bad
with,
guys,
and
bad
with the
people.
trials being shut down,
Those folks they have their protocol in place in the meetings we've talked to with the sheriff. Roughly, we've been running 315 people per day incarcerated in the jail. As you know, they have full-time health care, 24/7, that's provided by us each year that we contract for. So their whole protocol, the sheriff's got everything in place as to what they need to do and what they need to do if they get a COVID-19 case in there. And so they are, they're ready to go, and they're working with their medical people that are providing all the services to them. So let's hope that nobody gets it in there, and if they are, they are confined, and so they'll be confined in place, the same as they are currently at this time on there. So that's that. The other thing I want to bring up, we, as far as our meetings here, what we've looked at doing is like our commissioners, we meet every Wednesday. We're going to do those kind of by phone. I will be in place here on Wednesday when we have our normal meetings, and Denny and Mary Ann both will be on the phone.
no, I prefer to be here.
I'm gonna be on the phone because this thing is supposed to peak next week and I'm gonna be home.
And what we're trying to do is to make this as safe as possible for all of our people. Council is looking at the possibility of doing exactly the same thing, of they would have either one person here, or they were going to check to see if there was a way that they could not have the one person there. And our attorney has provided us with.
Well, actually, that was provided to you Saturday?
Saturday, right?
Lots changed since then.
And I was going to say, this guideline here that we have, Ryan worked hard on it, but there's been 4 more orders, and one of those changes even this, so
Yes, as
that's
of-
why I brought it up for
As of
discussion.
today, with Executive Order 20-09, the governor's previously issued Executive Order 20-04 was modified to eliminate the requirement of any member of the governing body being physically present at the meeting site. So all could attend electronically if that were the pleasure of the entire
Yeah.
body of the all members of the governing body. That being said, there's still going to have to be a presence of someone to take memoranda. And if you have the ability, which I don't think we do, I shouldn't say that, that's a rich question. But if you have the ability to live stream your meeting, they would request that you do so that the public and media can attend remotely and not have to be physically present.
We've made arrangements to audio record Wednesday.
And that would mean
That won't,
that
that
Beth
won't
wouldn't have to
overtask
physically be.
you, Rich. We can handle the punching of a button to get an audio recording.
Got my permission.
I think I can handle that. Plus, I think it's important to have 2 people physically present in case we actually need to take action.
Well, you can take action, Mary Ann, with 1 here and 2. That's what we've been,
No.
that's what we've been explaining to you, that we can do that. And also, the council can do that with all 7 of them being on the telephone.
Well, you can do it, but then it has to actually be, retroactively done later, right?
No, it doesn't have to be done.
They've revised that so
We've
that you can
explained
take
that
action.
to you, that that's not necessary to do
Well, if
it.
2 people can be in the treasurer's office, I think 2 people can be in this big room safely.
Just, one of them won't be me.
Fine.
Okay, all right.
Do I get
Fine.
hazardous duty pay if I show up?
That's right.
Normally have 4
What I'm looking at on department heads is that depending on which department it might be on there, that I would not have them come in here to present to us. If we needed a report from them, I would try and do that by telephone with a conference call, which we could do. We could have them on here. I think that easily in the next couple of weeks, in several of the departments that we have that report to us, we could go 2 weeks without getting a report. Our bridges, for example, with county attorney on there, or county engineer, excuse me, we have a pretty good report on all of those, where we are on all those bridges and everything. And the same way with Mike Sharp on where our roads would be at this time and everything, that we wouldn't need to bring, at least in the next couple of weeks, to bring them in here. We can do it on the phones. It may be a little difference with you, Steve, in some cases, but even you could report to us on phones if we had to go that way as to where we are on some of the buildings.
Could
And
you
you
send
and
us
I-
an email?
And you and I have to
Summary on-
stay in contact with what we're doing to keep everything up and functioning and running, and all the sanitation that we're doing within all of our departments to keep everything neat and clean on there as we
Do
move
you
along.
anticipate being here Wednesday, Steve? You know, if we could have a good 6-foot separation, I think it'd be nice if we could hear from you. And I think it's important that we get a report from Public Health.
And I will have the resolution for you on the pay continuation issues. That will also entail action by common council in the form of amendment to the salary ordinance. And I'll deal with the president of council on
Okay,
that.
all right. We'll work on that, and Mary Ann, I appreciate you coming in. I'm also concerned about Tom, and I know I certainly don't want us to
I mean,
send
wear a mask.
anything that way that might cause him some problems on there, but I'm more than happy to have you here if you want to come in.
I
but-
think we can take even more precautions. I would encourage anyone at any time to wear a mask and gloves. I
Well-
think we can take a lot more precautions than we have been, and I urge everyone to take their temperatures at least twice a day
Temperature part is good, but the mask, if
to
you are.
protect other people.
All right, if you are not ill and you don't have any symptoms at all, if you listen to the professionals, they say don't use a mask, because those masks that we need those for the people in the hospital that are working on a daily basis. And as they use up, we don't want to use up the supply that we need, because if our professionals get sick and they're not there to care for people, we don't want to do that. We have a limited supply of masks that we have, and we're supplying those to all the nursing homes and everything that way, and even some personal PPE equipment for them, but it's very, very limited. And so and if you watch the national news, they'll tell you pretty much the same thing, that it's those folks that if you have a cough or something, then you should be wearing that, because you don't know. And it's the droplets that really infect the individuals, but us that are healthy, and wearing a mask, you're just using a mask on there. At least that's everything I've seen that way. That's what they're saying.
Well, I'm very concerned about what I see in the stores around our food supply. I really want to talk to our public health people about that, because in other locations, the food supply is being protected in a much more cautious manner. It doesn't have to be a valuable mask. It can be a red bandana, for heaven's sakes, but because in other locations, people are wearing, you know, just a scarf, a bandana or something to protect against the occasional sneeze or cough. And before people can enter grocery stores, they are just wearing a bandana or a scarf. They're disinfecting the carts before every use, and people are just not sneezing and coughing on the food and the packaging. I really think that would really and truly cut down on the spread of germs and disease from those who are asymptomatic. That's the problem with COVID-19, is that people are symptomatic for typically 5 days. And with the testing being so grossly unavailable in this part of America, we are going to have to assume we're never going to get adequate testing. So I think if we are to be responsible, people should start wearing scarves or bandanas to guard against those occasional sneezes and coughs, especially around our food supply. And I'd like to have a conversation with public health about that.
You're more than welcome to talk to Christine anytime on that, and I'm sure she'll be more than happy to give you the public health opinion on that. Yeah.
I don't know if you've been to Walmart or any of the other large foods, if you've looked at our food supply lately, but I urge you to take a look at that. It's pretty scary to see just how unprotected our food supply is.
I have been there considerable, and I think the stores are doing very well. You're right. I go to Kroger's. Kroger's done a good job in having the material up front, so when you take one of the grocery carts, you can sanitize all that and everything as you go through. And their employees, they're not wearing masks. Nope, they're not. But they're all providing all the normal protection that they always do on a day-to-day basis to protect the food chain that we all have to eat on there. But check with Christine. You can see what they have to say and advise you on that
I just
particular
want
case.
public
but,
health to visit with us, I really do. We've had no conversations.
Well, we've had all kinds
You
of
have, but
conversations.
I think she needs to meet with the
But you
commissioners.
haven't. And by the way, we've had 2 major news conferences with Christine. Christine's done things with Eric on there to get the word out. She's talked to numerous folks that have called in with questions and stuff. And I think we're doing our best to get the information out to what folks need to do on there. But we'll work on it. Go find out.
I just think we
Yeah,
need
go
a
find out.
conversation.
Okay, is there anything else you can think of at the moment until we look at the other orders that he has that might affect us in some way?
For Beth's,
But we'll be here definitely back on
for Beth's
Wednesday.
benefit, the governor suspended the ability of anyone to make a public access request in person or by phone for the next 2 weeks. So they have to do it email or by mail.
Move to adjourn.
Okay. Marianne, anything else?
Nope.
Okay.
See you Wednesday.